Thanks for watching TMA's Legislative News Hotline wrap-up segment of the 86th legislative session. This time we invited TMA's Vice President of Advocacy, Darren Whitehurst, to talk about surprise billing. Darren?
You know, that issue has been a hot topic over the last decade. Started with the mediation process for balance billing that physicians would send out, allowed the patient to initiate a mediation between the patient, the physician, and the health plan. A lot of talk over the last several sessions about trying to take the patient out of it altogether. In this session, it really was a fast-moving storm. I think not only a desire to take them out, but basically a demand to take them out of the process of the out-of-network bill. So the patient will still be responsible for the patient's responsibility, co-pays, deductibles, those types of things, but again, wanted to set up a process that made the discussion on what the physician get paid really for these out-of-network services between the health plan and the physician. We started off by setting up a model similar to what they're doing in New York, a baseball arbitration system. You know, have lots of concerns, have a lot of education that we need to be doing to physicians so that they're aware of what the process entails, what things that they are afforded, the opportunities they're afforded to get paid for the services that they provide, and really want to make sure that the plans are paying appropriately for those services. But it ultimately sets up a baseball arbitration system, so the arbitrator will pick between the physicians, whatever they're submitting as a bill charge, whatever the plan pays, and the two sort of guideposts that you have are the 50th percentile of the average contract rate, and then the 80th percentile of fair health on the high ends.
The bottom line with that was TMA was fine with taking the patients out, but wanted the system to be fair for physicians.
That's exactly right. And certainly the bill that was filed was not very fair to physicians. It basically gave the health plans the ability to determine everything in the process. And the bill improved as the process went along. We have a lot of members to really thank for those efforts to improve the piece of legislation. And at the end of the day, I'm hopeful that we got a good piece of legislation, or one that the physicians can actually work with moving forward.
Thanks. And thank you for watching this wrap-up segment of TMA's Legislative News Hotline.